Hello there, Dr. Krish Bab here. The dural venous sinuses are a complex network of sinuses present inside the skull. Drain the venous drainage of the entire brain and bring it to the internal jugular veins. These are venous channels basically between the endosteal layer and the meningeal layer of the dura mater. They are not classical veins. They have only endothelium, they don't have muscle wall, but they are very capacitant. They drain the entire cerebral veins, drain the CSF also from the subarachnoid space via the arachnoid granulations and eventually exit out of the jugular veins. The various sinuses can be classified as unilateral and bilateral. Unilateral are present in the midline, bilateral on either side. The unilateral single sinuses, unpaired sinuses are the superior sagittal sinus, the inferior sagittal sinus, the straight sinus, the occipital sinus, and the confluence of sinuses located posteriorly. The paired sinuses are the sphenoparietal sinus, cavernous sinuses, superior inferior petrosal sinuses, the lateral sinuses, and the sinus sigmoid sinuses. Entire thing, drainage starts from the anterior cranial fossa, goes to the middle cranial fossa. From the posterior cranial fossa, they all exit into the base of the brain through the jugular foramen. The sphenoparietal sinuses, they drain into the cavernous sinus. Cavernous sinus in turn has got communication to the inferior and superior petrosal sinuses. The superior sagittal sinus, inferior sagittal sinus, transverse sinus all meet at the confluence of sinuses. From the confluence of sinuses arise the lateral sinuses. They take the blood forwards and downwards to the sigmoid sinuses. The sigmoid sinuses receive the inferior petrosal sinuses and eventually drain into the superior jugular bulb to form the internal jugular vein. The sinuses are of importance in neurology and neurosurgery. Head injuries can result in bleed from the sinuses or bleed into the sinuses. Blood clots in the sinuses by hypercoagulable states. Pregnancy, puerperium can cause a variety of problems including hemiplegia, epilepsy, and even death. Sinuses can also get thrombosed by septic emboli from the face, from the eye, cavernous sinus thrombosis, petrosal sinus thrombosis with deleterious consequences. They are very well imaged by the MRI imaging system, and most of the problems are very well tackled clinically as well. Thank you once again for listening for this topic on cranial venous sinuses. See you. Don't forget to post your likes and dislikes. Thank you.